reason, if you have to leave early, which I don't recommend you miss anything, but it does happen. So you have a recording you can go back to. And Professor McBride and myself, I also post recording in that particular week's announcement. So welcome, everybody. I am Dr. Zeller, and I'll share a little bit about me before we get started. I have been a nurse since 1985, which is a long time ago, and it seems like a long time ago. I originally was born and raised in Ohio, and then when I worked for about 2 years after I graduated from Ohio State. I worked about 2 years before my family moved to Florida. And I lived there for about 6 years, practiced as a registered nurse there, got a lot of experience, critical care, OB, and then some surgery training. And then eventually I ended up in Tennessee for the bulk of my teaching, or I'm sorry, my nursing practice. So in 2015, I graduated from Vanderbilt with my doctorate in women's health care as a nurse practitioner. Did practice as an OB practitioner for quite a few years, and then decided I've always wanted to teach. And I've been practicing for a long time, and it was time to start teaching. Even when I was a registered nurse back in Tennessee or back in Florida, I would always want a student to follow me around so I could teach and show nursing students how things are done. And so that followed me, that desire, through my master's program. So when I started practicing as a nurse practitioner, I actually precepted Vanderbilt master level students in my practice. So I did that until I quit practicing, and I went into full-time teaching. I feel like I have so much to offer students in this field because of my vast experience in all areas. I've got a little bit of knowledge everywhere. So working in surgery and OB, I've learned a lot. So I can help you with clinical judgment. I can help you recognize what you're seeing or what you should be seeing in a patient scenario. I can help you investigate. Nurses are investigators. We dig and hunt for information. We're looking, we're watching, we're reading a chart, we're making sure we're recognizing any trends in a patient's health care. How many of you are already nurses, LPNs? So, several of you. Okay. Well, congratulations for stepping up to get your registered nurse license. And how many of you are medical assistants or do other things in healthcare? A lot of you? Okay. Anybody not have any experience in healthcare and just really have a desire? Great. Welcome. We need all the help we can get. Okay. So that's a little bit about me. So now I'm living in Michigan. I moved up here to get away from the weather down there. It's too hot in Tennessee for me. And I love it up here. I have a daughter and grandchildren up here. My husband's from Toledo, or he's not originally from Toledo, but that's where he was living when we decided to get married and live in Jackson, Michigan. So we are here, and I'm excited. I've been with Fortis since 2019. And 2019, I was teaching on campus in Nashville, Tennessee. Met people at Cookeville. Some of you are from Cookeville. And I've never been to Jacksonville, Florida. Those of you who are at Orange Park, I've never been there. I should go. Centerville, I'm very familiar with. I've been to that campus. and you have a new dean, I hear, in Centerville. That's exciting. Uh, so, so as you can tell, a lot of you all might be familiar with each other on your particular campus, but we have students from all over. We've got a campus in Salt Lake City. We've got several in Florida, several Florida campuses, several Ohio campuses. We have a campus in Columbia, South Carolina, Norfolk, Virginia. Did I forget anybody? Okay, I don't want to leave anybody out. There's about 15 different campuses that students come from. And so I might be teaching people from all across the timelines. Okay, so that's a little bit about me. So, any questions so far about anything? Nope. So, what we'll do then is start a. See, we lost somebody. Oh, well, we're going to do an orientation for about an hour, and then I'll give you a 15-minute break, and then we'll cover some content. So if you haven't downloaded your syllabus, you can do that and look at it. Your syllabus is our guide. It's the structure of the class. And Canvas is pulled from the syllabus. So when you get online to Canvas, your OB shell, your maternal newborn experiential shell is built from your syllabus. Okay. So we'll be covering those because I really would like to do that. We cover bits and pieces of it in the orientation, but I would just really like to talk about each area today. Okay. So I do have a PowerPoint for us today, the orientation one that hopefully you have seen. And I'm going to open this up like that. So I'll be turning my head to my right, your left, looking at the slides. So welcome to the new year, by the way. I hope you have a great term. So the OB team. Now, I apologize, Professor Klein, I lost you somewhere, or you might be on another page. Anyway, I don't have Professor Klein's name in this list, but she would be another one. So we have a lead instructor who does our administrative stuff, okay? Professor McBride. I used to have that position, but I stepped down to give her an opportunity, and she's doing great. We have Dr. Elizabeth Roberts. She lives in South Carolina. Professor Shoemake, and I don't know where she lives. She works part-time for us. Professor Susan Luminoso, Professor Sarah Cox, and Professor Jennifer Alani, Professor Leanne Young. These are all our part-time instructors. The only full-time OB instructors are Professor McBride, me, and Dr. Roberts. Okay? You have access to everybody's information, and you are invited to attend their classes as well. But you have to be here on Mondays. Those of you who are my students, and those of you who are Professor McBride students have to be in attendance, camera on, to get credit. Okay, but if you want to go to a second class throughout the week, you can do that. If you really learn in that manner, then yeah, absolutely. So you can do that. Dr. Darlene Brown is what we refer to as our National Dean of Online Nursing Education. She's the top dog, okay? If you have problems, don't go to her first. That's not how you normally do it. If you have a job, you go to your supervisor, right? If you have a problem or a concern, please come to me, especially if the problem is me, okay? Come to me, let's talk about what is going on, okay? So and if I can't help you, I'll send you to someone on campus that might be able to help you. But if nobody's able to help you and you're not satisfied, that's when you go to Dr. Brown. I have had questions from students asking me about the simulation schedule or the clinical schedule. I don't necessarily know what day you have simulations on because every campus is different. And even within one campus, there might be a group of students that have simulations Monday morning. And there might be another group that has OB simulations Tuesday afternoon. So it's different on every campus. I don't have that information for you. It'd be nice if they'd sent that to me, but sometimes I don't know if they have it actually in place the first week. How many of you know when your clinicals are for OB? You have a date. Does everybody know? Have a date? Okay, good. Okay, great. You only have 2 days of OB clinicals, which is sad. I wish you had more because it does help, especially if you've never been in OB before and you have no clue what's going on. All right. As a reminder, etiquette, netiquette, we call it. When we're here, we're in a class, right? This is a professional environment. You're learning to be professionals. You're learning to have a career at a higher level. Okay. So be courteous to one another, respect each other. If you have a complaint, bring the complaint in a more personal way. In other words, one-on-one time with me or an email. Okay. Please don't just start complaining about things during class unless it's a topic you really want an answer for, and you can present it in a more courteous manner. I've had those conversations with students. They complain, they're concerned about the simulation charts, how hard they were, and we discussed it. So we could do that, but I just don't want someone starting to raise their voice and complain. Okay. Try to consider, even though you don't know everybody in the class, try to be considerate of what they might be experiencing. You have no idea what their life is like, personal life. So be very careful. Nurses don't judge. They're not critical of the way a person lives. Okay, so just be really careful. Try to use medical jargon. Okay, don't use words like "my patient drinks." Well, goodness gracious, I hope they drink. Maybe not alcohol, but they need to drink something, right? So when you refer to somebody drinking alcohol, make sure you say they drink alcohol or alcoholic beverages, okay? Those are the kind of medical jargon. So try to stay away from using that kind of jargon. So we start at 2:00. If you arrive at 2:01, you're late. Okay, you're late. If you're late 1 minute after the hour, you don't get credit for the first 15 minutes of class. So attendance is taken on 15-minute increments. If you're late 16 minutes, in other words, you clock in at 16 after 2, you've lost 30 minutes. So we have to be very, very particular. Same thing as a nurse when you're practicing and when you're working. You better be there early. Don't be 1 minute late to work. It means you're expecting the nurse before you to take care of the patients until you get there. So you're not being considerate of everybody else. So you need to be here every week. We do have a Martin Luther King holiday next week. I believe it is. No. I believe it's week 3. Right? Is that Martin Luther King week 3?
Monday the 13th.
Monday the 13th. So it is next week. Oh gosh. Let me look at my calendar.
Or 19th.
The 19th. Yes. So week 3. Every time I go to a different page.
So we have a quiz scheduled that day. Do we take that or no?
All right, the quiz. So what we will do is, since a holiday, we don't have class, right? So in week 4, you have an exam. After the exam, you'll do quiz 2. Okay, so you'll take the quiz the following week. All right, and we'll just have you do that after the exam. So don't show up Martin Luther King Day. I won't be here, and you shouldn't be. Okay? If you leave early from class, if you leave 15 minutes early, you lose 15 minutes. If you leave 10 minutes early, you lose 15 minutes. Okay? If you have something that is going on in your life, and it means that you're going to be late to class, you need to just let me know. Say, Dr. Zeller, I'm running late. I'm in traffic. And just kind of let me know. All right. The more you communicate with me, the better off you'll be. Okay. I'm running a little late, or I had to leave early because my dad needs me to do this for him, or my daughter has an appointment at 4:30. I'm going to have to leave a little early. And those things will happen. Just, you will get an absentee for that few minutes that you leave early or come in late, but it shouldn't add up to too much. Okay, try to avoid those situations. And we're going to talk about homework assignments, being timely. Are there any Salt Lake City students in here? I don't think there are. I think everybody's usually Orange Park, Centerville, Cookeville. Okay, so the structure of Fortis classes is built on, the time structure is built on Pacific time for some reason. We don't have any campuses in California or Nevada in that Pacific time. We do have Salt Lake City students, and they're in Mountain Time. So right now in Mountain Time, it's 2 hours earlier. So instead of being 2:18, it's actually noon, 12:18 in Salt Lake City. Okay, so know your time zone. Centerville, Orange Park, Centerville and Orange Park are all in Eastern time. Cookeville, you're in Central time, as you know, right? So for you, it's 1:18. All right, so keep this in mind, because your homework assignments are going to be due 11:59 Sunday night, but that's Pacific time. So those of you who are in the Eastern time zone, that means your homework assignments are due Monday morning at 2:59 a.m. early in the morning Monday. So you have a couple extra hours. And then Cookeville, it would be 1:59 a.m. That's when your homework is due for that week. And if you like visual aids, here's a picture of where you are. Academic integrity. This covers a lot. We have AI. Artificial intelligence now is creeping in to the educational realm. So if you have an app that takes notes for you during class, I will allow that, but it's not that beneficial. I can tell you that much. When you use your hand and a writing instrument, like a pen or a pencil or some kind of marker to take notes, there's actually a neurological process that takes place that helps you retain much better, even if you don't even read those notes again. So write notes. But if you use an AI app to take your notes for you, I will allow that during class, not during quizzes and not during exams, of course. But during regular class, if you want to do that, that's fine. Okay? AI cannot be used for your assignments. And I have a way of double checking that. You can't plagiarism. You cannot use another person's work as your own. That's putting it very concisely. If you read an article and you're writing down thoughts about that article, information you got from that article, you give credit to that author who wrote that article. It's called the APA format. Okay, so be very careful. If you share information about your homework with another student, you're just as guilty as that other student. Okay, if you're taking this class for the second time, number one, please let me know. Okay, and we need to meet. If you did work in a previous class and you submit it, you don't get credit for that. That's called self-plagiarism. So if you have a previous assignment that you want to use, change it up before you resubmit it, update it, improve on it, and then submit it. There's no group assignments in this class. You can't work on your homework together. Now, you might be sitting in the same room, but you can't work on the assignments together. You need to do them on your own, because when you're out there working as a registered nurse, you're going to be on your own. You need to be able to do it yourself. Okay. Any alterations of assignments, changing the date on your NCLEX, there's ways of doing that. You can't do that. Okay. So no cheating. Don't get onto any websites like StuDocu, or there's other ones, Course Hero. All of those are not validated. In other words, you could get the wrong information on those websites. The OB instructors have given you plenty of resources. You don't need to go outside of what we have given you. You can read the policy in the orientation PowerPoints. So I want to go back to attendance again, and you've got your camera on. Do not lay down during class. No reclining during class. You need to be sitting up in a chair or on something that shows that you're paying attention. You must be on camera for the full time. If you're not on camera, and it looks like Jody got her camera fixed. Jody, are you there? She's not in front of her camera. Okay. So you must be facing forward, or at least looking at the camera or looking at your classmates. Engage, ask questions, answer questions. Be engaged. You'll learn more. If you are here, but you're not on camera. Now, if you leave for 3 or 4 minutes because you had to go deal with something, or you had to quick go get something to drink, even though I give you a break. If you have to run to the restroom, you don't have to tell me that. It's not going to be a problem if you come back right away. But if you leave and you're gone for 10 minutes and you're not responding to me, I'll give you some more time. But if you don't respond, or you don't have your camera on and you're not responding to me, I could actually remove you from Zoom and you won't be able to get back on. Okay, so please please take attendance in this class very seriously. There are no makeups in this class. If you missed a quiz because you were sick, you can't make it up. If you get sick and you can't come to class, make sure you have some kind of documentation from urgent care or your doctor or your someone. Just have documentation that you went to get care so that after the end of the term, you might have an opportunity then to take that quiz. But for the meantime, no makeup quizzes, no makeup exams. So if you don't do anything for 2 weeks, if you don't come to class and you don't do any homework for 2 weeks, you can be removed from class. In other words, expelled. All right? You can just be removed from the roster. That's why I say it's really important to stay close to me. Let me know if you need something, if you need some help with something, if something's going on and you're going to be absent, please just let me know what's going on, okay? So my Zoom, because I record it, does attendance. It tells me at what time you signed on and what time you signed off. So I can look back, because there's no way I can keep track of you were 5 minutes late. Well, I'm not going to notice that just by looking at Zoom. Okay. If you have to leave for some reason, you have to go pick your child up from school. See if you can arrange for somebody else to pick your child up for school so you don't have to interrupt your class, but you would lose time. You cannot stay on Zoom while you're driving to go pick your child up. Okay. There's no driving during class. You cannot be a passenger either. You need to be in a stationary location. Okay. If there's no exceptions. Okay, no exceptions, unless there is something peculiar that's going on and you've already contacted me and Dr. Brown for permission to do that. Okay. No alcoholic beverages during class. No drug use during class. No vaping. No smoking. None of that. You're not going to do that on your job. You're not going to do that in class, right? You know, those substances do alter your judgment. Okay, you're not going to be able to focus and you're not going to be able to retain. Okay. We talked about what's this? We talked about the need to dress professionally, at least wear a shirt, you know, be covered up for class. You don't have to wear your uniform if you would rather not. You're more than welcome to, but you need to be dressed for class. Okay? No pajamas. If you wouldn't wear it to campus, you shouldn't wear it to your online class.
Yeah.
Steps for success. Number 1, be diligent and organized. Be diligent and organized. You know, organization and planning is half the battle, right? Half the battle. So spend an hour or more planning, putting in your calendar when your classes are, when your clinicals are, when your simulations are, when you work. Put it in a physical calendar so you can look at it and then say, okay, Tuesday afternoons, I have no obligations. So I'm going to work on my med surge. I'm going to read. I'm going to work on my homework assignments, or I'm going to prepare for clinical Tuesday afternoons and evenings and ignore everything else. So you can focus on med surge. Wednesday mornings, maybe you have free. I'm going to work on OB Wednesday mornings. not Tuesday with med-surg, just Wednesdays. I've got a gap of time, a block of time. I'm going to work on my OB. And maybe again Tuesday night. So plug in blocks of time for each course that you take, each class that you take. So you don't feel you're not jumping from one to the other. Read your OB for an hour and then go to med-surg. That's not time well spent. Okay. You have a pre-recorded lecture posted in Canvas in the announcements for every class, every week. There's a pre-recorded lecture that you can watch before coming to class, because you're going to either be taking an exam or a quiz. So it would behoove you to watch a pre-recorded lecture before a quiz. Okay. Read instructions. If I get a piece of furniture or something that I have to assemble myself, I look at the pictures briefly, but then I try to do hands-on and figure it out. Well, I always make mistakes. So I need to read the instructions first, right? Math questions. Don't miss a math question because you forgot to round like they said to round. In your OB1 calculations that it's due this week, you're supposed to only put the numerical answer in. Don't put any unit of measure. Don't put ml, don't put mg in your answer. Just put the number. Okay? That's what it takes to be very detail-oriented, reading the instructions exactly. If it says round to the nearest tenth, and you put in 20.12, that's rounding to the nearest 100th. It's still wrong, right? Because it said you're supposed to put in 20.1, okay? So we have to be very meticulous. Get your homework done. We have exam review sessions. We have optional sessions. In other words, we have Zoom different times of the week doing something that might be beneficial for you. Sunday nights at 7:30, I have a week review. Sometimes we'll do a case study. Sometimes we'll just do NCLEX questions. Sometimes we'll just be answering questions that you have. Anthony.
Oh, you said week review. Is that like for the prior week or what you just went over that week?
Yeah. Yeah, it's usually from the prior week, but we might go into a little bit of the following week.
Okay.
If that's what you want to do. I usually kind of let students guide me what they want to do on Sunday nights.
I'd
So
prefer to
at
go over
7:30.
beforehand.
Huh?
I said I'd prefer to go over beforehand, but
Okay. If that works for you, absolutely. Whatever helps you, that's why we do it. That's why I do it. Sunday evenings at 7:30.
Are we able to join that if we're in McBride's class?
Yes, absolutely. Yep. Just like Professor McBride has game days on Wednesdays, those of you in my class can attend Professor McBride's game day. I think it's at, I forget what time. I'm thinking it's in the morning. She has what? So you just sign on to her Zoom, and she does Kahoot games, Jeopardy games. So you can attend Wednesday mornings too. And she does record it as well as I record my Sunday evenings. So you have access to all of those things. So if you're utilizing these extra resources, that's going to help you get you
so
to where you want to.
if we're in your class, we can just go to announcements and go to her Kahoots or whatever it is.
Uh-huh.
Okay.
Well, it's in the, and I'll show it to you. It's in the optional sessions announcement. Okay. And that's why I like to go into Canvas too. All right. Keeping in contact with me is another key to success. Internet, reliability, computer problems, all that stuff. If you find that your internet is not stable or not reliable where you live, if you're at home, you might consider going to campus, especially for exams. You can go to campus and be on Zoom and use their internet service. You can take your computer, you can go to campus and tell the dean or someone there that you want to take your OB exam on campus and you need a quiet place to sit. And you can be on Zoom and take your exam. That way you don't have to worry about internet loss and stuff. You can do that. If any of you
Sorry,
have to
a
rush
quick
out.
question.
Yes, Tiffany.
Oh, it's kind of back to what Anthony was talking about, but like the resources for weeks 1 through 3, I see an option for the week 1 knowledge check, but there's no answer key. Do you guys send out an answer key or do we just?
I think there is an answer key. I'll figure. That's not my stuff, and
Oh,
but
okay.
I'll look at that. The knowledge check. Yes, and I think I know where it came from. It came from the OB workbook. Knowledge check. Those questions. Those fill in. I think it came from the OB workbook. But Tiffany, are you my student? You're not.
I'm not sure because I'm trying to switch to the 5 to 8 class.
Oh,
So I
let
don't know.
me see. Let me see something here. No, you're Professor McBride's student. I didn't recognize your name, but you want to move to, did you send out an email to Dr. Brown?
Yes.
Okay. Well, now, those of you who have done that, I'm glad you brought that up, Tiffany, because if you do your OB calculations and then you move to another section, in other words, you change your class time, your Canvas work does not go with you. So save the work that you did. So if you've done if you do your OB calcs before you actually get moved, put it on a Word document or some kind of document, copy them down on a piece of paper, write out the question, put it on a piece of paper and save it, because if you're moved, then you can redo it again in the new section and you'll already have all your work. Okay. All right. All right. So keep in contact with me. Let's see, maintaining your schedule. Try to, during class, try to be in a quiet environment. Try not to have people running around behind you and around you. You know, I had one student and it worked for her. She actually got in a closet during class just to get away from her family. She was hiding from her family, even though they knew she was in there. But the only way that she could get peace and quiet was in a closet. And I said, if that works, it was dark, but it worked. I thought that is a dedicated student, I tell you what. All right. Review the announcements for all your classes every day. Make sure you read in case there's another announcement. I try not to overwhelm you with announcements. So I might send you an email instead, although you probably get overwhelmed with emails too. But check your email at least once a day, okay? And your announcements every day. Make sure you get your homework done, homework assignments done. All OB instructors are available for tutoring. Tutoring is not a sign of failure. Tutoring, a student who requests tutoring is a very wise student, especially if they're scared to death. I had a student several quarters ago or terms ago that was scared, really scared of this class. And she grabbed me right away first week and said, I don't want to fail this class. What can I do? So we met every week for quite a while, for several weeks. And we basically reviewed the class again, but it gave her confidence and she did pass. So if that's what it takes, we can do it. I'll find time. Okay. Okay, so grading. How do we grade in OB? The components. Okay, so key KGAs are key graded assignments. In other words, quizzes, exams, and the HESI final. Those are your KGAs. And unit exams are worth 55% of your KGA average. Quizzes are only worth 5%. Each quiz is 1% of your KGA. The HESI is 20%. In other words, the most important thing you can do to keep your KGA above 78% is to score well on your exams, above 78% on your exams. Okay. So if you average 78% or higher at the end of the term on your KGA, you should pass the class unless your homework scores are very low. Okay. So your homework, NCLEX, sim charts, discussion posts, your math, the list in black here. Oh. If you look at this list of homework, no, listen, okay? Sim chart, 10 cases, 10 points, or 10%. 10% of your homework is doing your sim charts. That's huge. So I would recommend very strongly, yes, Anthony.
Is that just a completion grade? Like you have to maintain 80% or better and you get 100% for doing that, or is it score based?
No, it's score based. So whatever you get on that sim chart is the grade.
Okay.
Okay. So I would strongly advise that you complete the sim chart before you do any other homework. So next week is your first sim chart to do. Do that before you do discussion post. Because next week you have sim chart and a discussion post. You're not going to do the discussion post first. Do the sim chart first. It's much more weighty. That way, if something happens and you're late with your homework, your discussion post, it's not going to really affect your grade that much. Okay? So always, always, always do your sim charts. Your NCLEX questions, you have 4 sets to do. 1 every week before the exam. So in week 3, in week 6, week 8, and week 10, you have NCLEX questions to answer. That's the next important homework that you cannot miss. You cannot miss. You have to do them. Even if you get 70% on your NCLEX, it's better to get 70% than not to do it at all. You don't want 0% on anything. After that, you have your OB calcs, and each one is 1. Your teaching plan, and then there's also at the end of the term, weeks 9 and 10, you have some practice HESI exams that you have a link to in Canvas.
You said week 3, 8, 6, and 10 for the NCLEX questions?
Yeah, the week before every exam. So you have an exam in week 4, exam in week 7, exam in week 9, although that might be.
Oh, and I was talking about the NCLEX questions.
Yeah. So you are assigned a set of NCLEX questions the week before every exam.
Okay.
And that's the reason you're assigned those, to help you get ready for the exam.
And will you tell us which points to click when we like set up the exam questions? Like there's always there's a maternity one, but there's also a drop down menu. Will you tell us which ones to do?
Yeah, I do. I tell you exactly. In week 3, I have a picture of it in week
Perfect.
3. Yeah, so for the first exam, the only part of maternity, the drop down, you're only going to be choosing antepartum and intrapartum, only 2 of them. But it'll be an announcement week 3 for you, which I will open up for probably later this week, get all 3 weeks worth of material to you. Okay.
I have a question.
Yes.
Can we work ahead on the case studies and the NCLEX questions? No.
No. And the reason is because if you have a sim chart and you want to get them all done, and you're working on one for preeclampsia, we haven't even talked about it. How are you going to do it? I mean, you would spend so much time hunting for information, and it's not going to mean anything to you until you actually read the content and learn about the content before. So there's a reason for assigning them, okay? The same thing with the NCLEX. If you decided you want to do all your NCLEX ahead of time, that's not going to do you any good. The reason for homework is enhance your learning. So you want to do it when it's assigned to you, and there's a reason that it's assigned at that particular time. So no, you can't. If you do, I'll know it. You might do it ahead of time and submit it when you're supposed to, but there's a date on the top of your NCLEX that tells me when you actually did it. So don't waste your time. Don't waste your time.
And both of those are due Sunday at 11:59?
Yeah, all homework is due at the same time. 11:59, and that's Pacific time, Casey. Where do you live?
Florida.
Florida. So you're not Pensacola, though.
No, I'm Jacksonville, Orange Park.
Okay, so Orange Park, you're going to be due at 2:59 a.m. on Mondays. Okay. So the weighted average, in other words, we're going to average exams and quizzes in the HESI. But within that average, more value or more weight is going to be added to the exams. So that's going to influence your total KGA. So at the end of the term, if you've not been doing well on the exam, it's going to really be hard. I mean, if you've been doing 70s in the exam, you could pull it off and do really well on the HESI. That happened a lot this term for my students. But it's hard. Okay, so try to do your best on your exams. It's really important. Let's say at the end of the term, your KGA average was 74. No, let's say 74%. You're not going to pass the class. Okay, you're not going to pass the class unless your KGA is 78% or more, no matter what your homework is. And it's the opposite. If you do well and you're at an 82% for your KGA, but you didn't do your sim charts, or you didn't do your NCLEX, or you missed a lot of homework, or they're just low scores, you could fail the class, because we'll add in that homework and it could pull your average down. Okay, that's why I'm really stressing, do your sim charts first and do the best you can on them. You don't have to be perfect on the sim charts. By the way, there's a tutorial, a video that one of our instructors made how to do the sim charts. Okay, Tracy has a question about the math. Put it out on a Word doc. Yes, you can write it on a piece of paper. Absolutely. Any way of retaining that information of what work you did. You can put it on a piece of paper. Yeah. You don't have to do it in a Word document. You can put it on a piece of paper. Any other questions? Okay. So for the first 5 weeks, you're going to see if you look at your grades, it's going to give you a total grade for the class. And what you're seeing are your quizzes and your exams only. Great. Averaged out, calculated. In week 6, I will turn the homework on. In other words, your homework will also be calculated into your total grade. If you've been doing well on your homework, your total grade should go up. If you're not doing well, your total grade will drop. This just kind of gives you an idea how you've been doing on your homework. Okay, so I'll leave it on for a couple weeks and then I'll turn it back off so you can just see only your KG, which you should be focusing on. Okay. Late homework. If you're not going to get it done on time, send me an email. Send me a quick email or a text to let me know why you're not going to get it done. Or you can just say, I'm not going to get my homework done. And I'll say, well, try to get it done the following week because you have a grace period in a way. So if you get it done and you get it in before 2:59 Monday morning, then you'll get the grade that you got on your homework. If it's late, if you don't turn it in till Monday evening, I have to deduct your grade by 10%. It's a penalty for being late. But like I said, it's better to be late than not do it at all. Okay, so if you didn't get your sim chart done because you've been sick, let me know why you didn't get it. If you've been sick or you have a sick child and you're getting behind, you need to let me know because oftentimes I will give you an extension and not penalize you for submitting late homework. I leave that judgment up to the situation. Okay, but you have to communicate. That's why I said it's really important that you communicate with me. You can turn it in late, up to 7 days beyond. Okay, so it has to be in by the following Monday early morning, and you'll still get some credit, which is better than not doing it at all. But after that, you can't do it. I mean, you won't be able to submit it. Okay, why don't we go ahead and take a break since this is kind of at a stopping point. So I want everybody to come back at 10 after the hour, and then we'll continue on with our orientation, okay? Okay, we'll get started again. So this slide talks about the setup for exams and quizzes. So next week, week 2, you have your first quiz, and it covers what we talk about today as far as content. Okay, not the orientation, just the content for the first 3 chapters. So it'd probably be a really good idea if you watched your pre-recorded lectures, because we're not going to have enough time to cover. I don't have enough time to talk about everything that I talk about in the pre-recorded lecture. Okay, so and then Sunday evening, if you come Sunday evening, you'll probably have probably help too, since we'll be reviewing stuff Sunday evening. Okay. So the purpose of being proctored is so that I can watch you take your exam and you're not using other resources or your books or notes or anything like that during an exam. You can't have any notes or anything when you take your exam. ExamSoft, now I'm sure all of you are familiar that you have to download it on Exemplify on your computer, and that's how you access it. So you can't be on the internet when you're taking the exam on that device. So you do need to be on Zoom. So you need a second device, and that's usually your cell phone, that you can prop up during the exam so I can see you. I need to see your computer in your hands mainly. Okay, so we'll work on that next week during the quiz. So make sure you have 2 devices. Okay, you'll be able to get on Canvas during class to take your quiz. And you could cheat and go through the internet and hunt for answers, but I wouldn't do that if I were you. That's not going to help you. And I could tell when you log off, I could tell when you jump from one website to another on your Canvas log. So don't do that. Just do the best you can. And so we'll do that for the quiz next week. So you'll take your quiz at the beginning of class next week. Okay, and then we have class. There'll be 10 questions. One's going to be a math question. 7 questions are going to be from this week's content. There will be 2 questions on that quiz on week 3 content. Or I should say week 2 content, not week 3. Week 2 content. So week 2 is about the anatomy and physiology of pregnancy. So there might be 1 or 2 questions from that on your quiz. Okay. You only can take your quiz 1 time. If you are not on camera, you'll get a 0 for the quiz. And now that I see everybody's not having any trouble with their cameras, there's no reason that you can't be on camera during the quiz.
I have a question.
Yes.
Can you repeat what you said? 7 questions will be from this week's 1 through 3?
So every quiz is like that. There'll be 1 math, and then 7 questions on the quiz will be from chapters 1 through 3. Okay. 2 questions will be on your next set of chapters, which would be chapter 6, 7, 8, 9, 10. That's a lot of content.
Okay. And that will go for every quiz, the 7 questions,
Yes.
what we already learned,
Yes,
and then the
7,
2 is
1,
ahead.
and 2.
Okay.
Yes, every quiz. 7, 1, and 2.
And then 1 math question every quiz?
Yes. Your exams will have 50 questions, 5 of which are math. So you need to know your math.
Mm-hmm. Thank you.
For your exams, and I'll remind you about this, but for your exams, you will need a government issued ID or your Fortis ID, one with your picture on it, to show me before you take your exam.
Excuse me.
You can't use paper, scrap paper. You could only use a dry erase board or put a piece of paper inside of a plastic bag, like a gallon-sized plastic bag, so you can write on it and then wipe it off.
Excuse me, Professor.
Uh-huh.
Are
Yes,
we able
Cheryl?
to use this?
Yeah. Uh-huh. As long as you can erase it. Uh-huh.
All right.
Yep.
Thank you.
Yes. All right. All right. So you could only take your exam once. You can't retake it. If you've been sick during the week, don't take an exam on that day. If you've been sick or you've been in the hospital, let me know and we can postpone your exam. We can schedule it for another day that week. Okay? If you're sick, if something's been going on. Like every quiz and every exam, you have 1.5 minutes per question. So if there's 50 questions, that means you're going to have 75 minutes on your exam. If you start having technical problems, don't continue. Stop what you're doing and let me know. I'll be there, so let me know. Also, if you have accommodations, and you'll know if you do, you'll recognize that. You have a letter from Dr. Foster that you have accommodations. You need to let your instructor know. You need to let me know if I'm your instructor. If not, then you need to let Professor McBride know so that we can make our adjustments at our end. Okay. And just because you had accommodations last term doesn't mean that you still have them. So please get that taken care of before the quiz next week. If you want to take your exam on campus and there's someone on campus, a faculty member who has agreed to proctor you, you need to let me know 72 hours before the exam. So today is Monday, so you would need to let Professor McBride or myself know Friday. Okay, by Friday, if you're going to be proctored on campus. Don't assume, Cookeville students, that since they sent you a letter and they will proctor you, blah, 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 you still need to ask me. Okay, you need to let me know. If you know now that you're going to do that, just send me an email so I have a record of it.
Dr. Zeller, can we do our quizzes at home with the 2 devices and just go into school for the exams? Okay. Yeah. Thank you.
Mm-hmm. Yeah, you're not required to go to campus for anything, but it's an option for you.
Okay, thank you.
So those of you who might not have reliable internet and want to take your exam on campus because of the internet, you'll just be on Zoom. You don't need a proctor. You'll just be on Zoom with me. So if you miss an exam and you didn't let anybody know what was going on, you get a 0 for that exam. And that means you don't pass the class. If you missed it but you let me know the reason and we can get it done the same week, then there's usually not a penalty. But if you miss it and you don't let me know, you'll get a 0. If it was an emergency. So anytime you get sick this term and you're going to miss a class, you need to go see a provider so that you have documentation, because we save that information in case at the end of the term you're borderline whether you're going to pass or not. And maybe if you did take that one quiz, it would let you pass. Then we oftentimes will allow that. Okay, so just document your sicknesses or your child's. Now, don't share personal information about your children. Just some kind of picture of a document. You can redact or black out Social Security numbers. Make sure you do that. Medical record numbers, that sort of thing. Darken that part out. Even though it's confidential information, I would still do that. So don't wait until week 4. If you're not sure you're going to do well in that first exam, you're just not sure if you're grasping things, you better get with me before the exam. Okay? My review for the exam, every instructor has a review time, an exam review. My reviews are Sunday evenings, and you come to class Monday. So I just would really recommend that you come to my review and as many as you can, but come to my review. Okay, just remember that quizzes are in your Canvas modules. You'll just go into your module for week 2 next week and click on the quiz to start it. However, your exams, you have to do Exemplify, download Exemplify. Okay, technical. Your HESIs, one opportunity. You can't retake HESIs. So it hasn't changed. You still are required remediation for HESI even if you score 1200 on it, you still need an hour of remediation. And I'll be giving out this information again as we get closer to the end of the term. Okay, let's see. So determine now to be organized and put up a schedule. Even if you don't think you're an organized person, get started. Get started by printing out a schedule or even handwriting, or go to the dollar store and buy a cheap calendar that you can just plug in your classes. Okay. Refer to your Canvas modules for knowing what is due, because every week module will tell you. Your math calculations, I already told you this. Don't go to Google to get math answers, because it's not often right. KGA, or not KGA, kilogram. How many kilograms are there in a pound? Or how many, I should ask this way, how many pounds in a kilogram?
2.2.
2.2, okay? That's the number you use when you convert a child's weight, right? From pounds to kilograms. You're just going to multiply the weight, right? Or divide, sorry, divide. I'm going to get you confused. I have to think about it for a minute. If you have a child that weighs 20 pounds, to get the kilograms, you're going to divide 20 by 2.2. Okay, so kilogram is going to be a smaller number. So make sure that when you do your calculations on a calculator, or if you do them by hand, don't round anything until you get to the very end of the problem. You might have 1,458,000 mLs, then you round, okay? Then you round. All right. NCLEX questions. NCLEX questions, you have to, I did a short video on this that I posted, but when you get finished, you have to really follow the instructions on the NCLEX that's in your module. Okay. You have to save a PDF of your questions that you asked, that you answered. You have to save it, and you have to name the file appropriately. So just follow the instructions. So here's an example. Who was it that was asking me earlier? I forget about was that you, Carson, that asked me earlier about the NCLEX? Oh, okay. So here's an example. You're going to do exam mode, and you're going to do 50 questions. I'm not going to accept 25 plus 25. It has to be 50 at one setting. And for the first group, you're going to choose content area. And then you're going to choose interpartum and antepartum. So when you are finished answering all the questions and you click on the result, the completion, it'll pop up, and you're going to save it on your computer. And how you save it is nursing 202 _ whatever week it is. Week 3 will be your first one. The word NCLEX, and then your first initial, last name, and then the date that you did it. Every single time you do NCLEX questions, you have to put this on the name of the file. The week, your name has to be in there, just like this. So follow the instructions. You're going to put your name, not my name. Make sure the date will be 01/12 or no, it won't be that. It'll be week 3, 01 2026. No screenshots, no pictures. You'll get a 0. Case studies. Somebody have a question?
I just wanted to know if we can't, you just gave us the topics for the NCLEX questions. So that date has to be within that week because you said we can't work ahead.
Right. You would put the date that's, within that, whatever day you did it. Erica asked me if you're going to campus to take your exam and you have a proctor, you do not have to be on Zoom during the exam. If you have a proctor, and you're going to tell me who your proctor is, right? Then you don't have to be on Zoom. If you don't have a proctor, you need to be on Zoom, right? Yes, Tracy, exam reviews are recorded. So if you have clinicals that day and you can't come, or you work or whatever, they will be recorded. Okay. Any other questions? I'm just trying to answer the questions in the chat.
I have a question.
Yes.
Do we have to take the exam at a specific time on Mondays? Okay, so if we go to campus for a proctored exam, it has to be at
about the same time as a class.
Is it at 2?
Yeah, like at 2. Now, sometimes if the proctor, and I know several of them, if they say, I'd like to test the students at noon instead, and that's fine. But it needs to be on the same day.
Okay, we have the ones who go to Centerville, we have class until noon on Mondays. And so I was like, we could just stay there. And
yeah, that's true. That's true.
Okay.
So you have med surg in the morning, and then you have OB in the afternoon. And there might be some times where you have a test in both classes.
I think it'll be every exam. Yeah.
Med surg, you have 4 exams, so there will be one at least that you won't have both of them. But yeah, that's kind of rough. Okay. But that's a good idea. And then, of course, any of you that have a long distance to campus, you might think sometimes about, if you have a morning class, staying there and, taking your OB class while you're there, or being in OB on campus and then go home. And with that, if you have a long commute, if it's going to make you late to OB class, that, especially if the weather acts up, then you're going to be stuck. So, all right. So your sim charts, you can't do them early. Just do them the week that they're assigned to. Your grade for your sim chart is based on the quiz. So when you're reading through the case about your patient, and then you're taking a quiz, there's no reason you can't look up answers to those questions in your textbook. When you're doing a sim chart, if you don't know the answer to the question, look it up in your book. Look it up in your book. You can do that. It's a learning tool. You can look it up in your book, just like when you're working on your OB calculations. You can use your OB calculations, your Calculate with Confidence book, or any other math book that helps you with setting up problems. You can use those tools for your homework. But you only get one opportunity for your sim charts. If you do it once and score a 70% on your quiz, you can't redo it. I mean, you probably could redo it, but you're going to get the first grade that you get. The teaching plan is not until week 7. And I'm going to, like Professor McBride, is I'll give you a separate announcement for more information about the teaching plan. And this is the rubric. Everybody know what a rubric is?
Grading mechanism.
Yeah, it's kind of like, this is what we expect you to do, right? This is how you get your points for this. So if you do your teaching plan and you don't do the head to toe assessment, you lose 4 points and you only get 8 points for the assignment instead of 12. So you have to include all that information. APA. I've helped you out with this. Has anybody looked at the course cafe on Canvas? Yes, Brandy did. Go into your course cafe, which is underneath student, let's see, it's student resources. I can't even remember where it is. Course cafe. I gave you an article for week, I think week 2, you have a discussion. There's an article I've already given you, and I've given you the APA format even, so you get it right the first time. So read the article. It's kind of lengthy. Just you can go to the conclusion and get a better idea of what it's about, and then go into the article a little bit more and see what it says. So you can use that one for your very first discussion post if you'd like. And my goal is to find an article for you every week or every time you have a discussion question so that you don't spend time looking. But it's still good to look. Google Scholar is excellent for looking for articles. Just make sure you choose the ones published since 2022 or something. I can help you with all of that. But you can't use AI and you can't use any other thing to try to make it easier. All right. I'm not going to go over that. Any questions? You have a copy of this, right? This orientation PowerPoint. Okay. So in the announcement, let me go to the student view. So this is your week 1 guide. You also have guide to week 2. I've already posted it. So in this, you'll notice a format. It's kind of the same every week. I'll put the Zoom link at the top, and I'll put what you need to do before coming to class. And then I might have PowerPoints listed for you. And then you'll notice down here, it said read chapters 1 to 3 of your book. And then it has notes right here. If you click on notes, those are the notes that I took when I read chapters 1 through 3. So you can pull those up and you can kind of use those to study. And then as you're looking at your textbook and kind of skimming through it and reading through it, you can use my notes to kind of focus in on what you need to know. Okay? So do that for this week. And then here's your PowerPoint. And then objectives. And then, so female reproductive system. I think on Sunday evening, we're going to talk about some physiology, some anatomy and physiology, just to make sure that I know that you have a good grasp of the female reproductive system. Okay. So somebody looking at this picture, we've got a uterus in the middle. The ovaries are in yellow. The cervix is right here. And here's the vagina. This is the fundus, the top, right here. Once the egg is released from the ovum, and then it's fertilized by sperm in the fallopian tube, where does that egg implant to start growing? Where does it end up?
Uterus.
Inside the uterus, but more specifically.
Unless it's egg top.
The uterine
Right.
wall.
The uterus, the endometrium. That's that very inner lining of the uterus. Okay, that's where the egg is going to, actually it's a blastocyst by then. It implants there and the placenta begins to develop. So it's the endometrium.
Is that why people with endometriosis have a hard time having kids?
Yes, that's one reason. Yep. Endometriosis. Do you know what it is, Anthony?
Scar tissue of the endometrium? No.
Okay, it's some of the contents of the endometrium actually escape from the uterus. And they actually, we call them endometrial implants, can be found on the ovaries. And so that is usually the reason they have trouble getting pregnant, because they have a lot of implants of endometriosis on the ovaries and they have trouble with ovulation sometimes. Okay. So this week and next week, we're going to talk about the importance of preconception care. In other words, some counseling before a woman gets pregnant. What is the problem? What is not the problem, but why is that not always effective? Preconception counseling. Anybody know the answer to that question? Do women plan pregnancies?
Yes. Absolutely.
What are you laughing about, Ken?
I guess it depends on the woman.
Okay. Do you know that half of the pregnancies in the world are not planned? 50%. That's worldwide. So preconception counseling is kind of a challenge because most women, half of them don't plan, right? Half of them don't plan. So that is a challenge for us. But yes, Anthony, women who are in control and are very detail oriented, they know when they're ovulating, right? They know what to avoid.
14 apps to tell them.
Yeah, 14 apps to tell them. That's right. Okay. So remember that your homework for this week are the OB calculations. An introductory discussion is not graded, although you get points for it, but it doesn't mean anything. Just kind of let your classmates know why you chose nursing. Okay. Look at your PowerPoints, and there's, I posted a female reproduction system video here that you can just click on this link right here. It takes you right to it. Here is another PowerPoint for you. And I know Professor McBride has tons of things for you to look at. Yeah, but she's very good, very good. Try to come to Sunday's review, and I know some of you work, so I will record it. Go to the course cafe. Let me find the course cafe for you. Go to modules, and course cafe is under it's under course welcome. So here's your cafe, and you can use it for whatever you want to use it for. But I'm posting in it, and I gave you the article. So you can just click on this DOI right here to get to the article and read it. And then you can do your discussion post based on that. I also gave you a link to Google Scholar if you'd like to try something else. And then other places for good OB articles would be Medscape, it's free. The Association of Women's Health, Obstetric and Neonatal Nurses, and also the World Health Organization. These are good websites. And right now, I would recommend that you avoid the CDC because things have changed in our administration and they're changing what is evidence-based practice. And as nurses, we must use evidence to make clinical decisions. We must use scientific research. Okay, so avoid any government side, even the women's health government side. I would avoid that as well, unfortunately. But there are other things that we can look at. So that's week 1. And that's your course cafe. And you can use your course, you can go in there and post something to a classmate. So check your course cafe. All right. The welcome slide. Cheryl, are you talking about the modules? The course cafe?
No, the one you just was going over.
The course cafe one?
No, the other one, the slide. The welcome packet that you just mentioned.
Oh, that's in your you mean in the modules?
Yeah.
Yeah.
Under announcements, because we have another one. We have McBride, so we're not able to look that one up.
Okay, so
It's
in
different
her
because we're in her class. So are we able to go and look that up under your name or no? Because I know we can get stuff from your lecture.
I don't think so. I don't think, you know, if you go to Course Cafe in your module, you're not going to see the same thing as what my students would see.
Okay, okay. So I'm not able to access that slide. Okay.
But I can certainly send that stuff to you.
Okay, thank you.
Okay. Because I did share it with Professor McBride. That's what I was doing. So she wouldn't care if I sent it to your class. Okay, I can do that. All right. Any other questions? Excellent questions today. Thank you. Anybody thinking of anything? Professor McBride and I, you know, we have a lot in common, but then there are some things that are different. So you'll just have to go into your modules and see what is there. Now, you can't see week 2, and I can't even see week 1. Okay. Hang on just a minute here. All right. Announcements. So here we are in announcements, and I know Professor McBride has done this as well. So you have OB medications that you can go ahead and print out and begin to learn them. Homework grades. You are not allowed to record class or audio record anybody, video, audio, anybody, any other student. It's against Fortis policy. Some things that I know for my students that I've seen success when I look at this. If I have a student who has communicated with me several times or met with me several times throughout the quarter, they usually do better. They want to meet with me for exam feedback. They're reading their book and using the notes I give. They're getting their homework in on time. They come to as many reviews as they can, especially Sunday evening. They attend at least one exam review. They actively participate in class. Don't miss a clinical. Don't miss a simulation. If you don't get your clinicals in, if you skip out and you have to do makeups, it could mean that you could have a incomplete in this class. Learn as much as you possibly can during clinicals and simulations. Ask questions. Ask your instructor to clarify things with you. It's an opportunity. So take advantage of that. That's just another tool for you to learn. Another thing that you'll see is resources for weeks 1 to 3. Instructors weekly material for the first 3 weeks. So you can click on these announcements and go in. Like for instructors, week 1, Professor McBride's information, Dr. Roberts' information. Every single instructor has their information in here. Week 2, I even added a couple of videos in there for mine. And then week 3. So that's the instructor's information. If you want to look at mine, if you're Dr. or you're Professor McBride's, or you just want to look at another instructor's, you might find someone who you like better. And then the resources for weeks 1 through 3. You have week 1. Someone was asking about the knowledge check, and I think that came from the OB workbook that goes along with your textbook, but I'll double check. There are no flashcards for this week, but week 2, there are some flashcards that you have already in all of these. And then in week 3, there's some more. Here is where links to games that have already been played. You can watch the recordings. And then videos, all kinds of videos that we recommend. That's why I tell you, don't go to Google hunt for information. It's all here. Everything you need is all here. If you just need help with calculating infusion rates, click on that link. And then there are practice questions. I think somebody asked about this too. There's some these are just tools for learning. So somebody tell me, what does SBAR stand for?
Situation, background, assessment, and recommendation.
Right. Yeah. All right. So that's weeks 1 through 3. You'll get another set in week 3 for weeks 4 through 7. Okay. So just take some time to get used to everything, and you can always start with the announcements. I put an OB math. I put some extra stuff in there if you want to look at that. Also have your week 2 here that you can access. All right. So the Sunday recording will be available just in the announcements. I'll just put Sunday recording in the announcements. And I do share that recording with all the instructors. So Professor McBride will have it. Okay. And she will post it. If you can't find it, just ask her. Okay. She'll give it to you. Well, hopefully, Jacqueline, use Professor McBride's tools that she has given you. A lot of them are the same ones that I give. In the announcement, it has all instructors' tools through the week. You can use all of them. You can use all of them. They don't contradict each other. Okay. Just don't be overwhelmed. It happens. Anything else?
I have a question.
Yes.
So your Sunday evenings, I wrote down there was a 7:30, but then you just said something about a recording. Is that the same thing for Sundays?
Well, I record the 7:30 session. I record it.
Okay. So it's live at 7:30 and then you'll record it if you're okay. That's what I was confused. Thank you.
I'll post the recording from Sunday evening. Okay. All right. So, let's do a couple slides to make you think, and then I'll let you take another break, okay, since it's been an hour again. So, this is content from the first 3 chapters, just some concepts that are basic. You hear a lot about the term disparity. Okay, so to you, what does the term disparity mean? It's not disparity.
There's an issue.
Yeah. Well, what do you think of when you hear the word disparity?
Dismissive.
Dismissive?
Maybe not having enough resources.
Not having enough resources. Okay. What else? Disparity.
Not having access to things.
Okay. Not having access to healthcare. Okay. Okay. So, do we have currently a disparity in this country?
Yes.
Okay. So the word disparity means it means a gap, a difference between 2 or more things, a gap. In other words, this group gets plenty of healthcare, gets all the healthcare they need. This group doesn't get enough, or maybe this group doesn't get any. And there's all kinds of reasons. There is a disparity in healthcare. So when you think of that term, think of pregnant women or women who could be pregnant. Think of which women or which population of women are the most vulnerable would be the most vulnerable if they were to become pregnant.
Super young or super old?
Homeless.
Adolescents. And then advanced maternal age. So that would be above 35 years.
Mm-hmm. Homeless people.
Just a second. What'd you say, Tracy?
Homeless people. Homeless women.
Homeless, yes. I had a patient. She was only 16. She was homeless and she came in pregnant. So she's extremely vulnerable. What else?
Single women.
Single parent, huge. So think about that. Here you are, a student. If you're not married and you have children, or you don't have a partner, you're vulnerable as a student. Even if you're not pregnant, so you're vulnerable in other aspects. Who else?
People with medical conditions.
Okay, chronic illness. Can I put that?
Yeah, that's fine.
Okay.
Some cultures.
Cultural. Like what?
Maybe I should say some race. Sometimes I feel like that's a big one.
where they feel like they're
Racial.
only made to breed.
Yep. What else?
The Amish population.
Okay. Amish population. Vulnerable. And that has to do with culture, values, traditions.
Anyone living in poverty?
Okay. Impoverished. Yep.
The uneducated, or that doesn't have a great education.
I remember I hadn't been working very long, and I had a patient that didn't go to high school. She left school in grade school. She was afraid of everything. She was very fearful while she was in the hospital. It's because she had no education. She didn't understand anything. I shouldn't say anything. There was a lot that she didn't understand, and you had to use different words to explain things to her. So yes, they're very vulnerable. They don't know that they don't know, type of thing. What else?
Language barriers.
I'm sorry, Taylor, I didn't understand you.
Language barriers.
Language barriers. Oh yeah. If they don't speak whatever the nurse speaks, nurse might be bilingual. That's nice.
Polygamist.
What'd you say?
Polygamy. Couples.
Polygamy. So
POLY. Polygamy.
yeah. So it would be a woman who's married to a man that has other women.
Yes.
And why is she vulnerable?
They have many children, typically.
Okay.
Financial issues, stress, lots of different things.
Or STIs.
That too.
Frequent STIs. Okay. All right. All right.
Also location. Like if there's like in like Alaska, there's not many hospitals.
That rural population. And at least last I heard, south of Murfreesboro in Tennessee, Murfreesboro had great medical care. But if it was a high risk OB and they really needed special care, they would need to go into Nashville. If you go south of Murfreesboro, which is farther away from Nashville, you're getting closer to like Fayetteville, Tennessee. And it would take them almost 2 hours to get into Nashville. It might, and I don't think they're any closer to Alabama. So rural communities are everywhere. Okay. Okay. If you think of any other patients, what about mental or psychological illness? Or intellectual challenge? I guess we talked about that a little bit. Okay. Obesity. So there's a lot out there. So when we think of mortality, the maternal mortality rate is very high in this country, very high. And some of it probably are some of those disparities we talked about. I've heard stories from students, and I've read articles about this. In fact, I posted an article. It's from the preeclampsia website, but it's a journalist who wrote an article about racial disparity. It is really good. It's heartbreaking, but it's really good. Black women, African American women, women with dark skin are at high risk for genetic reasons, social economic reasons, racial reasons in this country. 3.2 times higher than a white or Caucasian woman for death, pregnancy-related death. And a lot of that is in the postpartum and 6 months beyond. So this statistic is about the whole big picture, pregnancy picture. So when she gets pregnant to a year after delivering a baby. A lot of things can go wrong after having a baby. Okay, suicide, heart disease is huge. Heart disease, diabetes. American Indian, Alaska Native, that group, 2.3 times higher. Hispanic is in that group too. World Health Organization. This is worldwide statistics. I enjoy reading about World Health. In 2023, 4.8 million children under the age of 5 died. And there's still a lot of stillbirths around the world. It's not just the US, but we do have a high rate for having supposedly the best health care in the world. We have one of the highest rates. So come to your own conclusion. So let's talk about culture. How many of you have had experience or have friends or acquaintances that are from a culture totally different than yours? Anybody? Not too many of you? Some of you? Okay. Okay. When you start working in a different place than what, let's see, let me lower my hand here. In a different place than what you're used to, and maybe it's in a large city, and you are coming across some different cultures. As nurses, we have to learn how to be competent in caring for someone who might have different beliefs than we do. Okay, so this is an example of one of these selections below. You tell me what you think about what this nurse asked her patient. How will your family members participate in your pregnancy, in your labor and delivery, and your parenting? What kind of behavior is that displaying? What kind of nursing behavior is that displaying? Is this nurse?
Is it culture relativism to see what the culture is about, to try to relate to her?
Okay, very good. Yes, exactly. It's in green. Okay, so cultural relativism. In other words, you want to know what information to your patient is important. In other words, you want to know how she expects or what her expectation is of pregnancy, of labor and delivery. What is her beliefs? What does she expect? You need to become knowledgeable about that. You need to ask questions. That's being culturally sensitive as well as competent to recognize that she might not like the hospital gown that you told her to put on, right? So being sensitive. What is ethnocentrism?
The total opposite, thinking that you know best. Your culture is the only way.
Exactly. So ethno means self, right? My ethnicity, myself, my beliefs, my culture, my values reign. Okay. And you should have the same ones type things. So that's being very ethnocentric. And we do not want to be like that as nurses. So do you know the difference between acculturation and assimilation?
Acculturation is no, assimilation is when they lose their identity, like they just go with whatever they're around.
Mm-hmm. Mm-hmm.
And acculturation, they change with the different groups from different cultures, but they always go back to their own culture.
So acculture, let me give an example. Assimilation. If we have someone from Japan that moves to this country and they speak some English and they're getting a job, okay, they want to learn some of the American values and cultures. We have a variety here. And so they pick up a few of those, but they're going to retain some of their own. So it's a blend. It's really a blend. They don't just have one culture, they have several that they enjoy and practice. So that's acculturation. It means not just one. Okay. It means no single one. Assimilation, you described it perfectly, is when they totally become an American. They want to do everything that we do in this country. They don't want Japanese food. They don't want to speak Japanese. They want to be an American. Okay. That's the difference between the two words. So, do you want to take a quick break, a 10-minute break? Okay. So let's come back at 20 after. Okay. Okay, let's get started again. Jean brought up in the chat about disparity. She also included domestic violence, and that's a whole population I totally forgot about. So intimate partner violence, human trafficking. In your book, it has information about kinds of signs that you would recognize in a woman that's being trafficked or being abused in one or more ways. So you might want to look over those. Okay. So I wanted to bring that back up again. So standard of care. What do I mean by standards?
The norm.
The norm.
Yeah, like best practice.
Best practice is better than the norm.
Sorry.
A benchmark, right?
Yeah.
All right. So how do we answer clinical questions at the bedside? How do we get answers?
Open-ended questions.
Okay. But I mean, as a nurse, how if you have a question, if you don't understand a technique, how would you go get an answer? How would you find out how? Let's say you need to do trach care.
I go get respiratory to help.
Or just ask someone that you're working with, or like management.
Policies. I would pull the policy or procedure for the facility.
Yep, policies and procedures. the facility's policy and procedure. That way you're covered. If you don't do it exactly like you should, then you're covered because you follow the policy, follow the procedure. Okay. How would you define a negligent nurse? Negligence as a legal term.
Well, in the book, it says that negligence is if a standard of care was not met and harm resulted.
Okay. Okay. Yeah. So you have a certain standard, the best practice. In other words, providing care at the highest quality. If you do not follow the policies and procedures and harm came to the patient, you're negligent. Even if it's just temporary harm, it's still negligence. Okay. What about failure to rescue? Somebody give me an example of failure to rescue.
Somebody's aspirating and they didn't make it in time due to some reason that shouldn't have happened.
Or seeing that a patient needs some assistance in any area and you just kind of ignore it and go on to do something else just because you don't want to deal with it at the moment.
Okay, yeah, both of you are correct. Anybody else have an idea?
Noticing like a patient is declining and you don't really follow up on it.
Okay, don't follow up on it. Good, good. You don't, if you notice that a new medication patient has some side effects and you don't contact the provider and the patient is giving that same medication again and it's starting to really cause problems, that's failure to rescue. I'm going to ask one thing, and Alhas, Alhas, what's your name? It's on your Zoom. It's Alhas. Alice.
It's Alicia. Alicia Haston.
Okay. All right.
So I got two Alicias in here.
Alicia is how do you spell it?
Alisha.
Haston.
Here, let's rename it.
There we go. Is that right?
Oh,
did I spell it right?
I got it.
All right. Thank you. All right. So standard of practice is the level of care or the level of practice that a reasonably prudent nurse would provide in similar circumstances. Prudence is looking out for the well-being of another. To put it simply, being concerned about the well-being of others is prudence. She's a very prudent nurse. She's very prudent. So not necessarily altruistic, but prudent. So to determine if it was truly negligent, the care is compared to the standard. And if the standard wasn't met and harm occurred, she's negligent. He or she. Accountability, the word accountable. You are accountable to practicing in ethical manner, doing the right thing. Legally, you need to be documenting what you're doing, because if you don't document it, it's not done, right? Don't document ahead of time. This is where we go back to how important it is to be organized. If you need help with organization, ask your supervisor. Or if you see another nurse, she always seems to be in control, ask her how she organizes herself. Professional. All right, so let's kind of gradually get into OB stuff. Let's see here. Is it possible to see the chats of other students post? Well, everything that has been posted chat-wise, I've been sharing with you. Okay. I turn off sharing chats during class because I don't want you to be distracted, and then I don't want it to be happening during quizzes anyway. Okay. All right. Y'all are good communicators. I can tell by your chats. All right, so preconception counseling, ideal, right? So you learned, how many of you took, so you've already taken health assessment, right?
Yep.
Okay, so when you took health assessment, you learned about an interview, right? What it means to interview a patient. So what kind of information do you collect in an interview?
Objective and subjective, meaning things that we can see all about the patient on our own and information that they give us.
Okay, good. Yeah, both objective and subjective is important. As nurses, we really struggle with that subjective. We want to see vital signs, right? I want to see this, I don't want to see that. We don't realize that the subjective information is just as important. Okay. So when we do counseling, preconception counseling, we're interviewing a patient. When we admit a patient to the hospital, we're interviewing them, asking them, why are you here? What surgeries have you had? What's your family history like? We ask all kinds of questions so we know how the patient's doing, what their support systems are. So when we do pregnancy counseling, we want to know all of that plus some. We want to identify anything about her life that could put her pregnancy at risk. We want to educate patients all the time. Every time they come in for a prenatal visit, we're talking about something, we're teaching something, or reinforcing something. And then if we know that she is in preconception counseling and she's obese, we know that she's a lot of risk facing her and her baby if she gets pregnant while she's obese. So we try to intervene to mitigate or reduce the effect of something before she gets pregnant. So we can do education on a client with diabetes and make sure their weight is under control before they get pregnant, make sure their glucose levels are normal or at least close to normal before they get pregnant. So preconception counseling is important to recognize the things that could cause problems. So we're looking at her health status. That's emotional, psychological. Maybe sending her to rehab if she's been on drugs before she gets pregnant. We need to look at socioeconomic things. She doesn't have any insurance and she's pregnant. Well, a lot of states, a lot of counties in those states have pregnancy insurance. In other words, it's insurance that will cover her through her pregnancy and the delivery, and it's public health assistance. So we can give her that information. Shelter and clothing. What if she's homeless? What can we do? So knowing community services that could help her. What about her nutrition? During pregnancy, you don't eat twice as much. You just need a certain amount of things. Okay, so we want to know what kind of intake she has had, what kinds of foods is she eating? What about her weight? Look at her weight. And then what about genetics? Does she have a strong family history for sickle cell or some other autoimmune disease? Is she an asthmatic? Her education level. Maybe we have to support her with pamphlets or handwritten things. What about her family? Does she have a partner or is she a single parent? What about her support systems? Is she working? How much? And then any exposures to secondhand smoke, or maybe she's smoking herself. So we're going to educate her. Hopefully, she can wait to get pregnant after she gets into a better state of health. So this is the purpose of preconception counseling. So some barriers, why not? Other than half of women don't plan their pregnancies. Only one of mine was planned. One of three. I get 30%. Okay. So barriers, why are we not seeing more preconception counseling, or why aren't women attending their prenatal visits? If they're not attending prenatal visits, the risk for problems grows. Okay. Maybe they can't get to the doctor. Maybe they have an issue with transportation, or they have a job responsibility and they have trouble getting away for their appointments. Or maybe they have childcare issues, no one to watch her other children. Maybe she just doesn't have a provider. In some of those rural areas of the country, there might not be an OB provider. It's a family doctor that sees her. And that family doctor might not be up to date on what's going on in OB. Age, adolescence. 16-year-old Meredith is pregnant, not planned. Her boyfriend doesn't know, and she's scared to death to tell her parents. So there's a little hesitation there, or a little delay on getting her to prenatal care. So she might be 5 or 6 months along and finally getting to prenatal care. Abuse. A woman that's trafficked or in a domestic violence situation might not come to prenatal visits early. She's going to be at risk. All right. So you can read the statistics. It's alarming. It's alarming, the amount of violence occurring in high school itself. All right, a little anatomy. So review female anatomy. This is a side view. So you notice that the uterus is sitting right on top of the bladder, just right on top of it. So at the beginning part of pregnancy, when you've got a blastocyst that's implanted on the inside of that uterus, the uterus itself also grows. The muscle grows. It's a muscle. So the weight of the uterus and the amniotic fluid and baby, even in that first trimester, can compress the bladder a little bit. So she feels like she has to urinate all the time. So urinary frequency is very common at the beginning of pregnancy. And then the other picture is about the ligaments that support the uterus in the pelvis. So when that uterus begins to grow and the weight and everything, the ligaments are stretched. So she might have some really sharp abdominal pain and even back pain. So I do want to talk about some vaccines during pregnancy. We do not give live vaccines during pregnancy because it can cause a problem with the baby. Okay, so those would be rubella, varicella, and human papilloma virus, HPV. We do not give those during pregnancy. We wait until after she's delivered her baby, and then we can give them. And then if we do give a vaccine that's live to a woman of reproductive age, we need to wait, or she needs to wait at least 28 to 30 days before she conceives again. We can give the flu shot, influenza, Tdap, which is your regular every 10-year tetanus combination, COVID, RSV. The Tdap, COVID, RSV kind of recommended in that third trimester. And the reason is because it not only supports mom's system, but baby will benefit from some of those immunoglobulins that are developed from a vaccine. So Tdap is going to help. The RSV vaccine in mom actually reduces the risk for a baby to develop SIDS. So, prevent the baby from getting RSV for those first few months. So huge benefit. And then, of course, it's not a vaccine, but the RhoGAM is the immunoglobulin that we give to mothers that have Rh negative type blood. They get the RhoGAM after delivery, within 72 hours after delivery.
I want to add something on that.
Yes.
For the RhoGAM shot, they also get that while they're pregnant. The mother does. I think it's 28 weeks, maybe.
Okay. Yeah. Mm-hmm. So we're going to give a mother with negative Rh blood if they have an abortion, if they have an amniocentesis, any time during pregnancy, if we're doing a procedure that increases the risk of mom's and baby's blood mixing, we're going to give RhoGAM. Okay. Routinely, it's given at week 28. Okay. There's really no research or evidence to back that up, but it's done, and most insurance pays for it. It would cover her if something were to happen, but usually we can give it at that time and she'd be safe. Okay. All right. So your week 1 OB calcs, that assignment is not timed, even though it's labeled as a quiz, it's not timed. You have your introductory discussion to do, and you've got chapters 1 to 3 to look at, to read through. Don't memorize any of the dates that are in that first chapter, like when the first pap smear was done, all that stuff. You don't have to know any of those dates. It's kind of interesting, but watch the pre-recorded lecture. I go over all the information. Set up your class and your study time in your calendar. And then next week, of course, you'll have your quiz to take. And make sure you watch next week's pre-recorded lecture before coming to class. So that means you're going to be busy this week because you're kind of doing 2 weeks in a row preparation. I mean, 2 weeks in a row preparation. Okay. This is an example of a calendar. Let's say you have OB on Mondays at 2, and on Tuesdays you have your med surge in the morning, and then you have lab in the afternoon. You're free on Wednesdays. Thursday, you're taking 204, which is probably a class you wouldn't take. And so you're gonna plug in Thursday afternoon for OB prep. Okay, Friday you work all day, Saturday you work all day, and Sunday you have clinicals. But you are going to get home in time to come to review. Anyway, this is just an example or a sample of how you could plug in your own study calendar. So on this one, you could consider studying your med surg on Wednesdays.
Hold on, did you say clinicals on a Sunday?
Sometimes. Mm-hmm.
Oh.
Yep, sometimes there are clinicals on Sundays. Yep, Saturdays. Just to get them in, because med surg has a lot of clinicals that they have to go to. So it does take time. Okay. So that's an example. So we still have about 10 minutes left. So we can just, you can ask questions or whatever you want to do.
So the first quiz you just said is it's over chapters 1 and 3 or 6 to 10.
Okay, so the quiz next week is going to have one math, and it's going to have 7 questions from chapters 1 through 3.
Okay.
Okay. And then there will be 2 questions on it from next week's reading. So even if you weren't able to get to week 2 reading and you get all the other answers correct, you're still getting 80% on your quiz. That's the thinking we had. Okay, Kwanda.
Hi, I have a question about the first discussion.
Uh-huh.
It says when I go to the grades tab on Canvas, it says that the first discussion is due January 11th, but then when I look at the modules, it says discussion 1 is in week 2. So I'm kind of confused.
Okay, so week 2, it shouldn't be due. Let me see. So you're my student, right?
Yeah.
I think it's just your initial ones due the 12th, ain't it? Initial response.
So week 2 is on the 12th. So your initial response is due on the 14th for discussion.
Okay. I'll change it. I just thought that it said the 11th. When I go
Let me double check to make sure I have it done right. Discussion 1 due January 12th. Well, that's not right. That doesn't look right. Let's see. Discussion 1. Due date January 12th. Available from January 4th through the 19th. So it's available after it's due because you have that extra week. So it's due January 12th. Discussion 1. Let me look here again. Now you got me wondering. Week 2. So we're in week 1. So it's assigned to, so it should be available. I need to fix that. I'll fix it.
Thank you.
Mm-hmm. Okay. Any other questions?
I think I missed something about the Cookville campus with the proctored test. We don't, just to clarify, we don't have to go.
No, no.
Okay, perfect.
No, you can stay at home and take your exam on Zoom. No, that's fine.
Perfect.
You're never required to go to campus to take an exam. You can do it on Zoom.
Okay.
Okay.
I have a question.
Yes.
So where do you find the schedule for the exam reviews from all of the professors? Like, where is that where I can see like which date they're going to hold it?
So we will post that the end of week 2.
Like the whole schedule of like what
Yeah.
date each of y'all?
Yeah,
Okay.
it'll be in your announcement.
Okay.
The exam review schedule and which instructor is having the review when.
So you'll post the end of week 2, and that's for the exam 1. So right before each exam, y'all will post for that exam.
It posts it. So during week 3 is when we do the exam reviews.
Okay.
Okay. And we need to get the schedule to you before that week. So we put it at the end of week 2 so that you
Okay.
can make your plans week 3 to attend it and then take the exam week 4.
But you'll do it prior to every exam? Or the whole schedule's coming out the end of
Oh,
week 2?
no, the schedule for each exam comes out, not the whole schedule, just for exam 1.
Okay.
Because, they don't own, yeah. Tiffany, do you have a question?
Yeah, so if I do end up switching to the 5 to 8 class, who will the professor be?
Well, there's several. I have a 5 to 8. So
Okay.
does, let me look here. So Wednesday at 5 o'clock, Dr. Roberts, Professor Young, Professor Alani, Professor Luminoso, they all have Wednesday evening.
But it's not Monday evenings?
We don't have any Monday evening classes.
Oh, okay. That might be why they haven't responded yet. Okay.
Oh, you were hoping to move to Monday evening at 5:30.
Yeah, 5.
Oh, no, there aren't any Monday evening classes.
Okay.
Do you know if there's any morning classes?
Friday morning.
Is it usually an issue to switch?
If you want, no.
Okay.
No.
This is like prime student or kid pickup time. So I think that's why we're having issues and trying to get moved to later, because you said we can't be in the car, and I don't want to be marked absent because I mean, I can't leave my kids at school.
Right, yeah, you don't want to leave them there.
No, they would be upset with me.
Yeah. If it's a real problem for you and you can't arrange for somebody else, then you need to probably send Dr. Brown a request explaining to her why you want to move to a different class.
Okay, thank you.
You're welcome. And there's lots of Friday evening. There's only 3 Friday evening classes. There's a Friday afternoon. So there's Wednesday at 2, Wednesdays at 5:30, Friday at 9, Friday at 3, and Friday at 5:30.
I'm going to add to that. So Carson is in my campus, and we have clinicals on Friday, I believe, for med-surg. And then I have a lab on Wednesday, 3 to 5 for med-surg 1. So I think today's schedule is going to be the only thing that will work for us, unless there's other options.
We could do Wednesday at 5:30.
Yeah.
5:30 to
That's
8.
what I'm going to try to do.
Yeah.
Even with having lab from 3 to 5?
I don't have lab 3 to 5.
Oh, I do. Okay. When is your lab? When's your med-surg lab?
1 to 3.
Okay.
Yeah,